Dr. Owenbrink with Appalachian Wellness, talking about how the disease of addiction distorts our perceptions. Things are not always as we see them. Addiction causes amazing distortions of perceptions. This happens not only when somebody is high, stoned, abused a drug, but even before the drug use has ever been started, before the drug has ever been tried. Addicts and alcoholics just see things differently. They react differently. They're born this way. The first use of an illicit substance seems to let the evil genie out of the body, accelerating the course of the disease of addiction. Addicts use these distorted perceptions to make decisions. Obviously, these decisions are not always in the patient's best interest. Their choices often lead to less than desirable results. The emotional growth is thought to stop at the age of first use of addicting drugs. This is even more pronounced with drugs such as THC from marijuana that affect the prefrontal cortex where judgment and impulsivity control reside. In short, addicts end up with changes in the brain that are best described as a form of brain damage, and they use these damaged brains to make their decisions. I'd like to illustrate this with a little bit of a history of two very interesting addicts that were related to each other. I first saw Aaron in the office. He came in with opiate addiction. He ended up on Suboxone. He did very well with it. He said he was going to meetings on a regular basis. He was doing everything he was supposed to do. One day when he came in after several months of therapy, he asked me if I would be willing to take care of his brother, Charlie. Charlie was an interesting case. I'll never forget him as long as I practice medicine and live. Just a really profound patient that was amazing in his recovery. Charlie slept a lot. He was always tired. He looked terrible when he came in, just chronically ill. Other than that, he was a good-looking guy. He was about 5'5", muscular, well-developed, tanned, blue eyes, but he just looked so sick. He was in terrible shape. I found out that he was an oceanographer. He worked mapping seafloors up and down the east coast of North America, where his master's degree in oceanography and his talent was highly sought after and desired by companies that did beach restoration projects. Charlie worked on offshore barges filled with heavy equipment and very dangerous working environments. There would be a lot of welding, repairing of equipment, things of this nature done on these barges. Welding produces fumes from metals. These are toxic. And I had a suspicion that maybe this was his problem. So as I started treating him for his cocaine addiction issues, I also talked him into doing a urine test for chelation therapy, which disclosed that he had a huge burden of toxic heavy metals in his system. One of the side effects of these heavy metals is they cause extreme fatigue. Charlie was sleeping 22 hours a day when I first saw him, and he was sick. We started him on a chelation therapy program to reduce the burden of heavy metals in his system, and at the same time, I put him on medications to help with his cocaine addiction. He had no trouble getting off of the cocaine. I was very surprised at this. He was going to meetings, he was working the program, doing everything I told him to do. Initially, he was still sleeping 22 hours a day, but with time that diminished to 20 hours, 18 hours, 16 hours. When he got to sleeping about 12 hours a day, he was able to go out and get a job, not doing oceanography, but working as a dive master on a recreational dive boat. One of the benefits of our relationship, he'd occasionally show up in the office with a cooler full of lobster tails, frozen lobster tails, which certainly made him a memorable patient as well. One day, Charlie came in and he said that his brother, Aaron, probably was not in recovery. He was very suspicious. He thought Aaron had relapsed. But every time Aaron came in, his urine drug screens showed what we expected to find. So it was somewhat hard for me to confront him on this. Aaron, in the meantime, being obese, found that he could go to India and have gastric bypass surgery in India cheaper than he could have it done in the United States. So with my blessing, he got on an airplane and went to India, being careful to explain to the doctors there that he was on Suboxone and could not take regular narcotics. He had the surgery, returned, had me remove the staples in the office, and everything seemed to be going great for both of them. Aaron was losing weight now, and Charlie was slowly recovering from his heavy metal disease. and starting to sleep less and doing better. In Charlie's work, he used to see people get severely injured and killed. He saw a few people cut in half and steel cables had snapped and whipped back and hit workers on these barges. I suspect that he was using cocaine therapeutically to try to stay awake as these heavy metals were eating up his body and causing so much fatigue. Aaron finally came to a crisis. One Friday evening, I got a telephone call, and he was out doing his thing. He decided to rob a bank. He had been using opiates. He had been selling his Suboxone in order to get pain pills that he was then crushing and snorting. He made a decision. He robbed a bank. He was wearing a jacket when he robbed the bank. On his way home, he stopped and burglarized a few homes in his neighborhood, homes that just happened to be owned by police officers who were working at the time. He went home, leaving his jacket on the front seat of the car, snorted some pills, nodded off, and was awakened by the SWAT team busting the door down. His mother called me that Friday night while I was out at the fair with my children, stating that there's been a misunderstanding, demanding that I prescribe Suboxone for him in the jail a couple of counties away. I explained that I could not do this, and sure enough, Adam had been in deep, deep trouble and did not come clean with me and did not address these issues that really harmed his recovery. Charlie was right. There was a problem. So meanwhile, Charlie continued to heal and get better and go back to work and eventually return to oceanographic topography, which was his specialty. He had been using the cocaine to stay awake, but he also had addictive tendencies because this is a family disease. The long and the short of it is, Aaron is in prison at this point. Charlie is alive and well and working a good program of recovery, and he is now cleared of his toxic heavy metal fume and taking precautions to avoid further exposure to toxic heavy metals. For Charlie, this story had a happy ending. Aaron, on the other hand, learned what happens to the people who don't pay attention to this disease. Two heads are better than one. Collective brain power can be a good defense. But where do you get the heads that can understand and reason with the addicted and afflicted? 12-step meetings. Look for group members with long-term sobriety and clean time. Get there well before the meeting starts. There is always an informal meeting before the meeting where people just sort of hang out and chat. Stay afterwards for the same thing, the meeting after the meeting. Perhaps you'll go out for coffee and pie or whatever. Join the group and become a part of that group. A home group is a very important thing. The folks who are going to these meetings now, remember, are the same folks who used to be the life of the party then. They love to have a good time. They like to laugh. They like to kid around, but they take their addiction recovery very, very seriously. They insist on having a good time. They insist on kidding around. They cannot keep the gift of their own recovery without giving it away to newcomers. Newcomers are helping them by showing up at the meetings. They will insist that this is true, and they really mean it. So even if you're not welcome anywhere else, they will welcome you warmly. And as far as your distorted perceptions are concerned, do them a favor. Share your ideas with them. When they finally stop laughing and pick themselves up off the floor and explain to you that robbing banks is really not a very good way to support your addiction habit, and that what you really need to be doing is going to more meetings, they'll be helping you, keeping you out of trouble, and you'll be helping them. The phrase we use is keeping it green, just like a young sapling has a green trunk as it's starting to grow. Keeping it green with the freshness of your struggle getting into early recovery reminds them of what it was like for them and will help them also to stay sober, stay clean, and grow more spiritually and emotionally as they're able to help you in your growth.